What two scientists, a doctor and a researcher at the VA discovered, they recorded 6,000 interactions between doctors and patients, 6,000. This began 20 years ago, this research. And they found that there was this factor that had no name, and they called it contextual factor. There were these things that if you missed them, if you didn't ask them about them, the treatment would fail. And it wasn't a minor part, okay? 40% of the time, one of these contextual factors existed. In some populations, it's up to 60% of the time. And 40% of the time, if you didn't get it, it would fail. The failure rate was about 1 in 8, And what these contextual factors were issues like these. In fact, they coded this. This is 20 years of research summarized in one slide. And this is the way when I interviewed them, they explained it to me this way. They said, listen, there was a woman who was getting dialysis, and she kept on missing dialysis. And then she would end up in the emergency room with emergency dialysis. We know that's way more costly, way more dangerous, often ends up in a hospitalization. It's not a good thing. Finally, after months and months, someone asked her, why do you miss them? I mean, you seem like you want to take care of yourself. Why are you showing up in the emergency room instead of going to your hemodialysis on a regular basis? And what she said was, well, I am taking care of my grandchild. My grandchild has a medical problem, and when he has a visit that conflicts with my visit, I have to make a choice, and I choose to go take him to his medical treatment as opposed to taking mine. Now, they understood the contextual factor, and they said, you know what, let's see what we can do. They came up with a solution, was to shift her grandson's treatment to the same center so she could go drop him off and then go get hemodialysis. Now, you might be thinking in your back of the mind, oh my God, that's so simple. Why didn't she just say something? Yeah? Are you going to tell your doctor? Are you going to tell the healthcare system, hey, I don't want to go there, I want to go here? No, not going to happen, right? But they asked the question, they identified the contextual factor. Now, what's magical about this, and this goes back to, remember those 3 convergent things I talked about, digital, humanism, and business model transformation. These scientists, in the last 3 or 4 years, hooked up with a state-of-the-art machine learning AI company called Laguna Health. It's out of Tel Aviv. Okay, the folks that founded it are Harvard-trained Microsoft engineers. And they've embedded these in the machinery. So now, automatically, patients who come out of a hospital, the machinery is scanning their transmissions, they're on an app, their activity, looking for these factors. The machine will pick up these factors. And then the care managers have another machine, it's called Harmony, that actually identifies the contextual factor, gives them questions to go deeper to make sure it's right, and then actually has the solution to the contextual factors. Yeah, it's unbelievable. It's called Laguna Health, worth checking out. The last thing I'm going to share with you about humanism, and by the way, I heard Todd talking before about, Todd Latz was sharing with us, in urgent care, you become a commodity. How do you differentiate yourself, right? And I was thinking to myself, well, why don't you start to embed contextual factors? I mean, you don't even have to embed it in the computer. Why don't you start asking people, I'm telling you to do this, can you do this? Are there factors that are preventing you? You could literally lift this slide, lift these contextual factors and begin to use them. I'm going to share with you finally, in the last example in humanism, another thing that you can lift. And I think this is critically important, again, in terms of differentiating yourself, in terms of delivering actual humanistic, person-centered, people-centered care to your clients. Yeah. So the VA also has spent the last 25 years developing research on something that's called whole health or whole person care. It's not a concept, it's not an idea, it's not a word. It's now being deployed nationally across all of the 140 medical centers, as well as the 1,000 ambulatory centers that the VA has. And what this whole person, whole health care means, it comes down to this one question. What they realized, and it's almost ridiculous that I am actually standing up here and saying this, but this is where we are, and this is where, hopefully this is where we're going. What they realized from the science is that if people, patients, let's just call it for the moment, patients are people. They're not robots, they're not widgets, right? Handing them a prescription, telling them what to do and expecting that they're going to mechanically just follow you doesn't make sense. We're people, okay? We have a consciousness, we have a soul, we have a spirit. The science tells us, and I'll give you two bits of information. First of all, if you have chronic loneliness, you are 26% more likely to die this year. Relationships are critically important, right? The second thing is if you don't have a sense of purpose and meaning in your life, you are also more likely to die. And for sure, you're not going to listen to me tell you about improving your health. They realized this, so what they did is they widened the aperture, and they don't only ask, what's the matter with you, which is fundamentally the question we ask in healthcare, what's the matter with you, and pursue that. They added another question, a really important question, a question that begs the issue of what is your purpose and meaning in life? What are you living for? What's important to you? And the question is, what matters to you? Not just what's the matter with you, but what matters to you. And they've embedded this question into their electronic medical record system, into their protocols of care. They've got you can look this up online, by the way. If you go to the va.gov, look up whole health. There is an entire operational program that takes this question and blows it out tremendously. And it's literally being spread across the country. I interviewed Dr. Ben Kligler about this well over a year ago, and a bunch of times. And in January, as I was finishing up the book Beyond the Walls, I called him up, and I remember this distinctly. I was in a Uber, and I called him up and I said, Ben, I'm finishing up the book. I want to have a whole chapter just on this whole health movement that you and others have been leading in the VA and have been developing for 25 years and now deploying across the country. Any updates before I send it to the publisher? Ben says to me, Dr. Ben Kligler says, well, Zeev, as a matter of fact, the Surgeon General just wrote an article about our program and says this should become the keystone for the entire public health service of America, the what matters to you movement, the whole health, whole person. So he's recommending that. I said, that's great, Ben. I'm going to put that reference in my chapter. And I said, thank you very much. He said, no, Zeev, wait a second. And I said, what, Ben? He said, oh, yeah. The National Institute of Medicine just published a 406-page report. They've been studying what we've been doing. They're recommending to Congress that just like the cancer moonshot, Congress should form a whole health, whole person institute to study and spread the whole person movement across the entire United States of America, every hospital, every clinic, everywhere. And I was like, Ben, that sucks. And he said to me, why? I said, because now I have to rewrite the chapter. Yeah, 406-page report. This is not the future. This is not even now. This has been going on. They've been developing this for years and now are deploying it across the entire country in the VA system. And soon, I think, to be copied. And again, when I heard again Todd talking before about how do you differentiate yourself? One question, that's all you have to do. One question, what matters to you in your life? Yeah. The follow-up question they ask is, and what can we do to help you achieve that? What's the one thing we can do right now to help you move closer to what matters to you in your life?